Hey guys, my name is Megan Neeson. I'm a pediatric critical care transport nurse and I live in Coconut Creek, Florida. I'm a first year's master's student in the Health Education and Behavior program at the University of Florida. The topic I chose for my encyclopedia project was that of paid maternity leave. As a mother myself, who only received 6 weeks of partial pay for maternity leave when I had my son, it was something that I felt strongly about. When I was about 5 months pregnant with my son, my mother's cancer relapsed and required numerous hospitalizations and surgeries. I didn't think twice about exhausting the time that I had banked in order to be home to help care for her. But when it came time to have my child, I was out of all my saved up time. Because this happened, I only had available to me the short-term disability policy that I paid separately for. This policy only reimbursed my salary at 66% for 6 weeks. At the time of the birth of my son, I was the primary breadwinner for my home, and this decrease in salary was not something that we would be able to live off of for long. I remember when I went back to work how unnatural it felt to leave my tiny human home. At 6 weeks postpartum, we didn't even have a pattern for sleep, wake, and feed cycle yet. Most developed nations agree with the notion that mothers should be the one home raising their children. Within the United Nations, there are only 7 countries that do not afford paid maternity leave to their citizens. The 6 other countries have a collective population of 8 million people. The United States alone has a population of roughly 330 million. The risk of return to the workplace too soon for mothers is multifactorial. We have found that the recovery from birth itself often ends up delayed and complicated, as well as the risk of rehospitalization postpartum is significantly higher. When mothers are allotted the appropriate time for recovery, this change is dramatic. We also find that the precipitous return to the workplace dramatically decreases the rate of a successful breastfeeding relationship and is also often associated with difficulty of bonding between the mother and the baby. The risk of mom's return to work during the postpartum period is seen early on. However, with children, it's not seen as imminently. Without the appropriate time home, we do know that infants and children are often at a risk of increased mortality. Infants are at a risk of hospitalization. And there is a trend associated with mothers returning to workplace and babies missing vaccines on schedule. Then there is the uptick of childhood diseases that is frequently seen with mothers who return to work too soon, and that association is not noted for us as general population because these diseases are seen later in life, often toddler years, school age, and teenage years. Some of the diseases that we see with children whose moms return to work too soon are things like type 1 diabetes, childhood leukemia, and childhood asthma. The increase in these diseases are said to cost the United States about $13 billion annually. And then the last thing that we noted is children that are left in the care of others besides their mom during that formative early time are studied to have difficulty bonding with their mothers and perform lower on standardized tests as they get older and have lower high school graduation rates. 26 weeks of paid maternity leave is the minimum recommended time by the American Academy of Pediatrics. 26 weeks is the studied time for a full recovery from an uneventful labor and delivery. It is a length of time for exclusive breastfeeding that's recommended, as well as that time that is needed for that formation of a relationship between mom and baby. That attachment between mother and child is so powerful. It is an indicator of future social and emotional outcomes. At the end of the day, this sadly reminds me of how low of importance the family unit is to America. Our children are the future of our nation, and the dissolution of our families is hurting our nation in so many different ways. Our adults are hurting, our children are hurting. Violence is being seen at the highest rates ever, and I cannot think that this often has to do with the lack of social and emotional skills that our children are having from the lack of bonding during the early years with their parents. Caring for humans should be